Heart disease. It's the leading cause of death for women, more than all cancers combined. The good news here is about 80% of cardiac and stroke events can be prevented with education and action. Dr. Mary Axelrad, a primary care physician with Holston Medical Group, educates her patients during their visits. She says it's one of the keys to living a long, healthy life. But women need to know their heart attack symptoms are unique.
Women experience it different than men. It's not always the classic chest pressure, chest pain. They can be a little nauseous. They can have some other symptoms. They can have arm pain or jaw pain instead.
Dr. Axelrad said there are several things women need to know to prevent a stroke or cardiac event, not just their family history.
So the good thing is there's a lot of things to do, a lot of behavioral changes people can make. Is your sugar running a little high? Is your cholesterol some high? Are you not exercising? Are you, going out to fast food every night? So we just had to talk about those sort of things and even little changes people can make. Have you gained some weight in the past year? Can we inch off there and try to improve your health? And all those things together, without medication a lot of the time, can really decrease your risk.
So what can we do to prevent a potentially catastrophic illness like a heart attack or stroke? Axelrad recommends quitting smoking, eating healthy food, and exercising.
Try to move around for at least 30 minutes, 5 days a week, and get your heart rate going. That's what you want to do.
Even if it's just a brisk walk around your neighborhood?
Don't care what you do. Even if you go watch a YouTube video and dance, I couldn't care less. It's just you're sweating and you're moving and your heart's beating, and that's perfect.
And if you have heart disease, you can still have quality of life.
You can live for a very long time after one of these events. It's not a death sentence.
It's very important to remember. As for alcohol, women are encouraged to not have more than one glass a day, and not before sleep because that can mess up your sleep, and not more than 2 drinks in a night out.